So our group did is on chapter 9, alternative medical systems, which is traditional Chinese medicine. We have Elizabeth Keller, Tiffany, David, and Rebecca Shin. Next slide. So the goals of what we want the students to know is that traditional Chinese medical is basically a medical system that has been used for thousands of years to prevent, diagnose, and treat diseases. It is the base on the belief of qi, which is also the body vital energy flow along the meridians in the body, and it keeps the person spiritual, emotional, and mental and physical health in balance. Traditional Chinese medicine aims to restore the body's balance and harmony between the natural opposing forces of yin and yang, which can be block qi and cause diseases. Also, traditional Chinese medicine includes acupuncture, diet, herbal therapy, medication, physical exercise, and massage. It is also known as the Oriental medicine and known to be called TCM. Next page. So an overview of our summary is alternative medicine systems are an entire system of health theory and practice that develop separately in conventional medicine. These systems typically use a variety of methods that fall under the CAM umbrella: herbal remedies, manipulative practices. Traditional Chinese medicine relies heavily on the use of energy-based practices such as acupuncture, like said, based on the belief in the uninterrupted flow of energy through 20 meridians is necessary for the maintenance of health. The quality of clinical trials performed to evaluate traditional, there have been a number of studies of traditional Chinese medicine in the treatment of various development disabilities, which includes cerebral palsy, intellectual disability, as well as ADHD.
So there are 4 main practices for traditional Chinese medicine. The first one is acupuncture, which inserts steel needles into acupuncture points on the body to affect the flow of qi through the meridians. Next is Chinese massage therapy, also known as Tui Na. This form of therapy manipulates and mobilizes the soft tissue in the body so that it stimulates the qi energy and brings the body back into balance. Next is Chinese herbal medicine, which uses different parts of plants for brewing, stewing, and squeezing them into medicine. Lastly is Chinese diet and exercise therapy. The Chinese diet therapy identifies food as yin and yang. And the 2 forms of Chinese exercise therapy includes Qigong, which focuses on the mind and breathing, and Tai Chi Chuan, which involves slow movements intended to strengthen your body as well as improve balance and flexibility. So there are 4 main theories that form the basis of traditional Chinese medicine. Theory of qi, known as vital breath, vital force, life force, vital power, and moving power. This is a force that animates humans and the entire universe, as well as uniting the heavens and the earth. It also is an energy source that flows through unseen channels called meridians from the surface of the body to the body's organs, therefore unblocking the circulation of qi. The meridian theory states that there are 12 major meridians or channels that are linked to the 12 major organs in our body. These meridians form a complex network through the body that links the organs, skins, flesh, muscles, and bone. It consists of 2 main roles: preventing harmful energies from entering the body and indicating the presence of harmful energy already in the body. Therefore, any diseases or illnesses is a sign that the meridian is out of balance or blocked somewhere in the body. The theory of yin and yang comes from a traditional Chinese medicine belief that everything is composed of 2 opposing but complementary energies, yin and yang. They are complete opposites but cannot exist without the other. Therefore, they can never separate. They are also reflected in medicine with yin and yang structures, yin and yang characters of the organs, and yin and yang symptoms of illness. For example, weakness of yin organ can cause death, but one can survive even with the opposite yang organ is removed. The theory of 5 elements state that the 5 elements found in nature can be used to explain the relationship between the physiology and pathology of human body and nature. These 5 elements, fire, wood, metal, earth, and water, are constantly moving and changing because they are dependent on each other.
Two valid and reliable studies. The first one is a systematic review and meta-analysis on Beijing Qingan from health benefits for health benefits randomized control trials. So there was 19 control studies related to Qingan. It was a 10-year research trial through Harvard, Emory, and Yale, and it was published in the Journal of American Geriatric Society. People who participated in the trials had overall better balance and reduction in risk of falling by 47.5%. Other findings that they had was there was positive effect on quality of life, better sleep quality, increased balance and flexibility, levels of blood pressure were more leveled, and then psychological benefits also, like reducing stress. The other study that was found was rewiring the primary somatosensory cortex and carpal tunnel syndrome with acupuncture, which was published in 2017 in the Journal of Brain. The study contains 80 different patients at 6 major hospitals and medical centers, promising positive outcomes in treating CTS, which is carpal tunnel syndrome. The study was focused on true carpal tunnel compared to sham carpal tunnel or sham acupuncture. Comparing the levels of pain in the patient, the true acupuncture was used in the hands and the opposite ankle. This produced great results in improving function in the wrist. The study was able to use MRI technology to determine the correlation between brain function and pain sensories related to CTS was improved by using acupuncture.
So provider training. So the completion of an educational training program is usually a master's degree at minimum, and some programs like the program on the right, Yosan University, even offers a doctorate level program. So the master's is usually a master's in acupuncture and traditional Chinese medicine, and the training is completed both in the didactic and clinical setting. In order to be eligible for a state license examination, an individual must complete a minimum of 3,000 hours of theoretical and clinical training. They also, in order to pass the California examination testing, the competency of the acupuncturist to become a licensed acupunctural therapist, and some crack detection. So the first one is a basic like Yelp or Google review, something like that. So reading the reviews on the provider. And the second one is more of a in-depth license verification, which can be done through the California website. Next slide. So finding 2 frauds and scams about this practice. So the first one was false medical billing to insurance companies in order to swindle more money out of the providers. So it was essentially an acupuncturist who was scamming the insurance agencies out of fake plans, so they got more money. And the second one was an unlicensed acupuncturist that was not licensed to unintentionally hurt someone as a result of their inexperience, causing a collapsed lung. And how can it be prevented? So to verify the provider's qualifications and reviews from other patients, making sure that there's nothing concerning about the provider. And secondly, making sure that they are clear to practice and do not have any issues with their state licensing, which is public record.
Some questions that you can ask your provider before visiting. What type of acupuncture do you perform? What method/technique of acupuncture do you deliver to patients? Does it change depending on the area of treatment? And are you certified to treat those techniques? And the next question would be, for someone who has never used acupuncture before, what does a normal session look like? How long is it? Does it hurt? And how often would you recommend doing it? For someone who has been diagnosed with IBS and can't figure out how to manage the symptoms, will Chinese diet theory help manage or reduce symptoms? I'm looking to use Tai Chi as an alternative way to help with my balance and anxiety. How often, like once a day or twice a week, would I need to participate in Tai Chi? These are questions that you can ask your provider and making sure that they are educated or well-rounded in being able to set up with the correct way of performing whatever is needed.
So finally, below are 3 sources that have information on specific traditional Chinese medicine provided by the U.S. Department of Health and Human Services. Any consumer that wants additional in-depth information regarding traditional Chinese medicine can use these valid and reliable sources for more information.